Hello viewers, my name is Benta Terry again here.
Hello viewers, my name is Dr. Vyas. I am a senior consultant physician and specialist in cardiology and diabetology.
Welcome again to Clinics with Dr. Vyas, and today again we are going to talk about heart failure. From the last video, most of you asked us a few questions and today we are going to tackle them. Doctor, one of the viewers asked about the types of heart failure. Does heart failure have types?
Yeah, that's a very pertinent question.
Yes.
Heart failure can be classified based on the ejection fraction. Ejection fraction is a measure of the contractility, that is how well the cardiac pump is pumping the blood. Okay, so heart failure can be classified as heart failure with preserved ejection fraction and heart failure with reduced ejection fraction. That means ejection fraction is a measure of cardiac function, as I told you. When the EF, that is ejection fraction, is less than 50%, there is something wrong with the contractility of the heart. Okay, so any ejection fraction above 65 is good ejection fraction. 55 to 65 is fair ejection fraction. 45 to 55 is mild LV systolic dysfunction, and 30 to 45 is moderate LV systolic dysfunction, and anything less than 30 is severe LV systolic dysfunction. Okay? So when the ejection fraction is preserved, that is ejection fraction is above 55 and above, if the patient is showing symptoms of heart failure, that is what we discussed last, the symptoms, and if the pro-BNP is elevated, we classify this particular condition as heart failure with preserved ejection fraction, and this is one of the easiest conditions to treat because it can be reversed.
Okay, nice to know.
The second thing is heart failure with reduced ejection fraction. The problem with reduced ejection fraction is most of the time we cannot reverse the reduced function, but we can only control the symptoms. So these are the different types of heart failure and also the stages in heart failure.
For the viewers to understand the EF, that is ejection fraction. One can visit a cardiologist and do echo. That is where we get to know if it's reduced or it's over. Okay. Doc, again, you spoke about managing the reduced EF. What do you manage it with? Like, are there specific medicines or?
It depends upon the patient to patient. As I told you earlier, there's a wonderful medicine by name sacubitril and valsartan. That is one of the best medicines for tackling the heart failure, but it may not be suitable for everybody. But in many people it is suitable. Apart from that, we give a class of drugs by name diuretics. Diuretics means they make you pee a lot, thereby reducing the edema, the swelling of the feet, and also usually the hallmark of heart failure is that patient is usually edematous. That means there is lot of water retention, and that we reduce with diuretics. And there is a new class of drugs by name SGLT2 inhibitors, which because diuretics have many side effects, SGLT2 has less side effects. So that also we give. And apart from that, we can give something called digoxin. Digoxin is a it's a class of drug which increases the contractility of the cardiac muscle. Also reduces the rate, the heart rate, the pulse rate. And apart from that, we also give beta blockers. Beta blockers are again which reduce the heart rate, thereby reducing the workload. So these are various options. When all these things fail, that's when we have to book the patient for heart transplant. And if that is not possible, we can refer the patient to ventricular assist device.
And all these viewers, you don't go get them over the counters, you visit a cardiologist. Yes, doc, still on heart failure. There are these patients who have convulsions. But the convulsions come with a low rate of the heartbeat. Now they don't have palpitations, they have...
No, palpitations,
they are there, they're not there.
Convulsions are not related to heart failure. I think you're telling about palpitations.
Yeah, palpitations, like a heart...
Palpitations can happen because of many things, okay? There is something called anxiety neurosis in some people. Who are prone to anxiety. Palpitations happen generally. Okay, but that is not heart failure.
It does not have anything to do with the heart generally.
With the heart, palpitations have nothing. Not necessarily. But palpitations is one of the hallmarks of heart failure.
Now, Doc, you're making us not.
Palpitations alone doesn't indicate heart failure.
Oh, okay.
It has to be present
With
the six cardinal features of heart failure. What I told you.
Okay.
So some of them should be there. At least 3 of them should be there.
Okay.
To suspect something to do with the heart.
Yeah. Now we get it. And you had mentioned about high cholesterol.
Yeah.
If one is not obese per se. But there is high cholesterol when they do the lipid profile. I believe that is the right
this
test.
is one of the myths actually, that obese people have high cholesterol. It's not so actually. Cholesterol for the cholesterol to increase in the body, first there should be genes which make you susceptible for developing high cholesterol in the body. On the top of that, your lifestyle should be bad. Like you are consuming a lot of processed foods, you are drinking a lot, you are smoking a lot. All these things should be there.
Yeah.
Then the cholesterol
is high.
Increases.
And now with high cholesterol, there is also chances of any heart disease.
Yes.
Yeah, okay.
High cholesterol leads to ischemic heart disease.
Yeah.
That is blockage of the blood vessels in the heart, and the heart tissue dies where the blockage happened, and that affects the cardiac contractility, and that leads to heart failure.
Now, Doc, that you've mentioned ischemic heart disease, is that also treatable?
Ischemic heart disease is actually, when it is diagnosed early, we can put the stent and we can even prevent it.
Okay.
But when the heart attack happens also, in the immediate hours, in the first 6 hours it is identified, we can stent the patient and we can prevent heart failure in most of the cases.
Okay, but most people ignore, I bet.
The reason for ignoring the chest pain in Kenya especially is that native Kenyan population, they are not prone to ischemic heart disease. They have good genes.
That is actually good to know. Yeah. And Doc, in every time you mention about heart failure, there is a point that comes up, the high blood pressure. Like most of the Kenyan people, there is a certain age now. They have most of let's say people from 45 years.
No, not even 45, even early actually.
Oh,
I have studied it extensively. The occurrence of hypertension in Kenyan people is very early when compared to the same socio-economic strata of population in other countries. So Kenyan people, especially women, they are developing hypertension by the age of 33.
That's
and men, they are developing at the age of 35. It is actually reverse in other countries.
Yeah.
Men are more prone, but in Kenya, women are more prone. That is one trend we observed. And also, 50% of the people above the age of 50 years are hypertensive in Kenyan population.
Now mentioning of hypertensive, Doc, could unmanaged or uncontrolled hypertension lead to heart failure?
Yes. Uncontrolled hypertension is one of the leading causes of acute left ventricular failure.
Okay, so if you have hypertension and it's controlled well, there is like at least
you are saved
from developing heart
failure.
Thank you, Doc. That's much
information
information for all of us. Anyone with hypertension should see a cardiologist, because with that managed, I think heart failure
can be prevented.
Thank you again.
If you had liked this video, please like, share and subscribe.